Hello, welcome back to Big Ear Provider Training. In this section, we're going to look at the ear canal and eardrum as seen by a provider doing an initial examination of a customer's ears. It's important for us to know what healthy ears look like, but also the issues that we might see that would stop us from creating either impressions or earplugs for this customer and instead give them a referral to a physician. Now, when performing an initial ear examination, the main things to check for are obstructions. Below, or as we move forward, you're going to see pictures of issues to look out for. The canal and eardrum should be clear of inflammation or obstruction. Before we get to the issues, let's see what healthy looks like. In the picture on the bottom left, you see a healthy ear canal. In the second picture, you see a healthy eardrum. Now, neither one is showing any discoloration, any obstruction, or any perforations. This is a healthy ear, and this customer is someone who we would be very happy to create earplugs or impressions any day of the week. The following pictures showcase common issues that need to be addressed before we can make impressions or plugs. On the left, we see a picture of impacted cerumen. Now, cerumen itself, or earwax, is just that yellowish waxy material that's produced by the sebaceous gland inside the ear canal. Its job is to lubricate, clean, and protect the inner lining of the ear, so it's supposed to be there. The problem is when you get too much, and when there's too much, it's an issue. On the right, we see a picture of an eardrum that's very different than the first one we saw. This one is perforated, at least in one spot, if not two, and we see that bleeding occurred when that perforation happened, and that's what's causing the discoloration. In both of these examples, we would not want to create either impressions or plugs for this customer. Instead, we'd want to send them to a physician. In the picture on the left, we see an example of inflammation, in this case caused by swimmer's ear. On the right, we see something that was done intentionally. These are tympanostomy tubes, or in this case one, a tympanostomy tube. Basically, these are sometimes called grommets, T-tubes, ear tubes, or even vents, and they're small tubes that are inserted by a physician in order to keep the middle ear aerated and to prevent the accumulation of moisture inside the middle ear. So before we could do anything with that, we would need for the customer to get a release from the doctor saying it's okay for us to either create earplugs or impressions. In the picture on the left, we see a bony extrusion, which could have occurred prior to being born, could have occurred as growth from childhood to adult happened, could even have occurred from a recent fracture. Bottom line is we can't move forward until a physician gives us the okay. And then the one on the right is a little more complicated. Now, when you're doing your initial examination with either your otoscope or with your ear light, you're going to be able to see this foreign object. In this case, it's cotton. In most cases, it's going to be a big chunk of earwax or cerumen. When you touch it, if it moves, it may be something that can easily be extracted, and then you can reevaluate and see if you can move forward. In many cases, though, it's going to be impacted, it won't be movable, and it will be something that will stop us from moving forward with this customer and have to send them to a physician. Now, in any of these cases, prior to doing an initial examination, the customer would have filled out the paperwork, including their big ear care and consent, and also their risk assessment. The risk assessment should give us kind of a roadmap to what items we might see, but in some cases either the customer doesn't know or they choose not to inform us of a problem they might have. That's why we need to know what to look for.